has also been an integral core member of the HairDAO team. We have Andrew Baxt, and then we have the man of the hour, the reason we're all here, Professor Ralf Paus. So before I sort of let Ralf give his own introduction, he's very, very humble man, and so I'll sort of hype him up a little bit and give him his flowers. So we looked on the Dimensions global database, and Ralf has been cited when you search hair loss or androgenic alopecia 21,797 times, compared to the second place researcher who was cited 8,438 times. So he's pretty much running laps around the competition at this point. He would never tell you that, but I will. And outside of that, he's currently a professor of dermatology at the University of Miami. He previously taught and researched at the University of Manchester, Max Planck Institute, Yale, the list goes on. Outside of academia, he runs a research company called CUTANEON and a wet lab called Monasterium. So with that, Ralf, I'll let you take it away and give us a little more of your background if you'd like, a little more color.
Yeah, so I'm actually like you guys, I'm a hair nerd. So I got into this when I came out of medical school back in Berlin then, and I knew I wanted to become a dermatologist, but thought, well, maybe I should get some serious research training first. And I ended up in a lab at Yale where they made me work on hair, and I thought that was a terrible subject. And after 2 weeks, I got completely hooked on the subject, and I realized that's the world's best model organ you can possibly do research on. And people care about it, otherwise we wouldn't be sitting here. Well, I've been doing for about 15 years clinical dermatology, first in Berlin and then in Hamburg. And then I defected into doing research and having more fun than ever. And on top of that, thought that, well, maybe some of the hair research essays we developed in the human system, also in mice, in the university, might as well be put to good commercial use. And so we are offering this as a commercial service in Monasterium laboratory in my hometown in Münster in Germany, which is now part of the KIMA organization. And just a while ago, I made another company in Hamburg, Germany, where we engage together with industry in co-development projects and with people like you who say, well, you know, this man suggests some crazy hair project. Let's see whether we want to cough up some funding for it. And the first one we agreed on was thyroid hormones as potential hair growth stimulants.
Yeah, perfect. So before we sort of get into the full thyroid hormone study, I'll just let Baxt and then Benji introduce themselves, and then we'll dive right into it.
Yeah, Andrew Baxt, also known as Andy1 on Discord, co-founder of HairDAO. Just to give a little background on HairDAO, the idea came from both, I mean, Andrew can speak for himself, but have been suffering from hair loss for at least a few years now, can probably go back to high school. We were just joking before about how I used to be called Patches in high school. So yeah, took that on my shoulder. And yeah, had been in crypto for a while. Saw VitaDAO in the summer of 2021. And then shortly after, just from dealing with my own hair loss journey and really realizing that the current solution set just isn't adequate, that I didn't have much time, to be frank, that there was an opportunity here to build an alternative, really an alternative pharmacy system. We'll have to cut around that little word, but that's really it. Here we are.
Cool. And so now we have Benji. Benji's from corporate, aka Molecule. Just kidding. In all seriousness, he's like part of the team, and so I'll let him tell you guys a little bit more about himself as well.
Awesome. Thanks, Verbs. So yeah, my name's Benji. I'm a product manager at Molecule. First time I came across HairDAO was I think on Twitter. And to be frank, I thought it was a joke. I didn't really understand it. Why are these guys obsessed with hair? Maybe it's for losing your hair if you have too much hair, which I certainly do on everywhere but my head. And yeah, it really took kind of sitting down with you guys and really hearing your journey and your story and to realize how serious this really is, and the impact that hair loss has on people that are experiencing it. And so once I heard your story and realized how little funding was going into hair loss research because the NIH doesn't consider androgenic alopecia disease, the more I kind of wanted to get behind you guys and support you and this massive community that you've assembled that's all super interested in coming up with new options. As you guys kind of alluded to, after I started going through my own
Yeah.
hair loss. Yeah, it's happening. I started to realize how much snake oil was out there, and it's basically a competition to see who has the best search engine optimization to sell you their questionable therapy.
Very
And
true.
so I think that kind of leads into what we'd love to hear from you first, Ralf, which is there's so much garbage on the internet. Can you please break it down in as much depth as you would like, or breadth as you'd like? What do we understand about hair loss? What do we understand about the hair follicle and why it stops churning out hair
you might as well
at a
ask me,
certain
what do we
age?
understand about the universe, right? Can we please break this down to more digestible questions?
Totally.
Give me one a bit more concrete.
Well, so I think what we'll say is, so just before we keep going, I'm also Andrew, other co-founder of HairDAO.
Yeah.
Besides being the world's greatest moderator, I'm co-founder of HairDAO. And like Beck said, suffered from hair loss from the time I was 20 years old. Also, got involved in crypto through investing, and then sort of saw HairDAO as this perfect opportunity to realign incentives in an industry that I think has been held back more by incentives rather than any sort of biological or technological progress. I think one of the interesting things to sort of frame the Hairy Matters podcast that Ralf, you and I were talking about beforehand, I think I had mentioned like, oh, we're going to talk about cutting edge, spicy research in hair loss. And I think you made a great point, was that the most important thing is that we actually establish a foundation for what we currently know in hair loss throughout the course of this podcast, because I think so much of I guess the lack of progress that's been made in the space is really due to the fact that there's so much sort of fundamental mapping that we don't understand. I think there's so many different pathways, different genes. We're not sure if we need to upregulate them, downregulate them, and all that. And so I think what's most important is that we establish a true sort of solid foundation that we can then build off on to eventually solve hair loss. So I think that's what we'll cover in following episodes of the Hairy Matters podcast, along with sort of, you debating hopefully debating some of the other hair loss researchers on maybe some of the more controversial topics, and then also using it as sort of an opportunity to answer a lot of the questions, that I know our community is constantly like, can you ask Ralf this? Can you ask Ralf that? And so we'll use this podcast as an opportunity to give you a way to speak to them as well.
Yeah, you have already been giving me hair loss with all these questions. So, it's a challenge. It's a challenge.
Yeah. But so without that, without further ado, I think we should hop into the thyroid hormone study, which
Andrew, before we do that, maybe
Yep.
I should give a little less flippant answer to what Benji asked.
yes,
So
yeah.
I think medical progress comes historically has come in two forms, right? One is serendipity. Somebody just observed something and did something, and lo and behold, it gave you an effect you wanted, even if you didn't understand why at the time. That basically is what happened with minoxidil and finasteride, right? These were the fruits of serendipity. Or medical progress comes from understanding the biology of the organ you want to target more deeply than you have done before. And that has been a challenge in human hair research, because most of the research, basically all of the funded research, is mouse research. And the mouse hair follicle and the human hair follicle are not the same. They underlie different controls. They have all sorts of different differences in their response to the same agent as human follicles, which need to be taken into account. So one of the major challenges we are facing, and that has kept me busy for the last 2-3 decades, is to really understand how much of the ton of hair biology we have learned from the mouse and the fantastic mouse models that exist is really transferable to the human system, and what is not. And since that is always very difficult to answer, my take has been, let's do all this research on how the human hair follicle works as much as possible on the human follicle itself. And do this in hair follicles one gets from hair transplant surgeons, that one organ cultures, or in scalp skin that one transplants on a living mouse, and that you can then study the human organ on the mouse for a very long time. And that has been driving our research approach. And the other problem is hair loss. Now, when people talk about hair loss, they often talk about completely different things, and they're comparing apples with pears. So when we are talking about male pattern balding, that already is something else than female pattern balding, a totally different clinical problem, even though it shares many similarities. And that, again, is something completely different than alopecia areata or chemotherapy-induced hair loss, and so on. So when we talk hair loss, you guys are interested in androgenetic alopecia, right? There we have another problem, that there is so far no really great mouse model that imitates human androgenetic alopecia sufficiently, other than taking human scalp and transplanting on a mouse, and then see, do I get the effects, the hair growth effects that I want on this, in this human scalp skin transplanted on a mouse. The other problem one has in the field, and that has inhibited progress in the field, is androgenetic alopecia is a double-edged sword. So on the one hand, you want to reduce the daily hair loss. That's what the hair shafts you shed when you comb or shower. And on the other hand, you need to, first of all, stop the miniaturization, the progressive miniaturization of hair follicles that you see beautifully at your and my hairline, Benji, right? Andrew keeps hiding it. Right? So that we need to stop, and then we need to reverse it. And again, how do we do that? How can we study this? How can we model this? And in order to make breakthroughs in treating androgenetic alopecia, particularly male pattern balding, we need to have the right models. And we are only now getting there. And the mouse, pure mouse models, will never be the right model for androgenetic alopecia.
Ralf, do you mind if I ask another question about that?
Please.
Super quickly? So yeah, it's one of the things we talk about quite a bit at Molecule, which is this model validity, which is the predictive power of your disease model on the actual phenotype or disease of interest. So if you don't mind me being like very explicit, like how do we know that your disease models are actually more predictive of male pattern balding or
that's
androgenetic alopecia?
That's a necessary question. So it's all about validity of the model, and validity, beyond validity, is you want to see how much does your model give you a phenocopy of the human disease. So the best way of judging is whether, or there are two ways of judging it. First of all, do I still have the phenotype of the human disease? And to me, male pattern balding is a disease because people suffer from it, right? It's not just a cosmetic problem. It is, if you suffer from it, it is a disease. It makes you sick. Does the mouse model or whatever model you use, does it imitate enough of the clinical phenotype? That's the first one. The second one is, does the model respond to proven drugs that work on a patient? Does it respond in the same manner? That's the second benchmark. And the model Amos Gila in Haifa and I have recently published, where you transplant balding human scalp on a skid mouse, does exactly all of that. It preserves the miniaturization of the hair follicles by themselves. They do not get retransformed into large hair follicles, but if you give finasteride or minoxidil or platelet-rich plasma injections, you can partially reverse this. This, to me, is the litmus test for model Validity. And that's the only in vivo model we really have so far that I think ticks the right boxes. However, it's a very difficult model. How many patients are going to give you a chunk of their scalp and allow you to transplant it on a mouse, right? So you need models before that in vivo stage, and that's another surrogate model on the so-called ex vivo level, a preclinical model we are working with. We take totally normal human scalp hair follicles from occipital skin right here, or from frontotemporal, and you culture them isolated in organ culture or in follicular units together with the surrounding skin, and you expose them to androgens. And then you see, is the follicle showing at least some of the phenomena that you would see during balding. You will not see the entire miniaturization process in this preclinical model because the follicle cannot be kept alive long enough in the test tube, right? But in the few days, you will, for example, see that the key inductive fibroblasts that control hair growth in the so-called derma papilla of the hair follicle, that they keep moving out of the follicle if you stimulate them with androgens, and you can treat them with some drugs that prevent that. So that, to me, is a surrogate model that you use to narrow down the candidates that you then want to, in a second step, also study on the in vivo part. And you can also use this model for something else that we have shown is actually very powerful. So there are lots of drugs, actually they're not a lot, but some drugs that give you unwanted hair growth. Too much hair growth where you don't want it. Cyclosporin A is perhaps the most classical. Or minoxidil itself, also another classical example. And what you can use these hair follicle organ culture models beautifully for is to figure out what is the mechanism of action, how the follicle gets stimulated. And then we prove that this is possible. After you have figured out the mechanism of action, you can then target it directly with a much less toxic drug, and perhaps even with a cosmetic compound. And for cyclosporin, we have shown that this can be done. And none of this had to be done on a mouse. It could be done in microdissected organ cultured scalp hair follicles. So if it depends on the questions you ask, whether the model is suitable or not. Do not overstretch what your model can deliver. Be aware of its limitations, but suck it dry as much as you can.
Yeah. And so the 2008 study, Ralf, that you did with thyroid hormones was on, as you described, hair follicles in organ culture. And we very much view this study right now as the sort of, the precedent, or sorry, not the precedent, wrong word. What's the
continuation?
The continuation of that.
It is, yes. Yeah. And I've been wanting to do this study for a long time until you convinced somebody, I still don't know who, to fund it. So great.
Yeah.
So this study, so what we, okay, very good. So let me go a little bit back to the time when I was still working as a clinical dermatologist and was running hair clinics in Berlin. So I had many patients that had either too much thyroid hormone or too little of it, so hypothyroidism or hyperthyroidism. You know that thyroid diseases are among the most common of all diseases, and thyroid hormones, L-thyroxine, are among the most frequently prescribed drugs of all time. Mm-hmm. But the problem is, I remember if you measured in these patients the serum levels of their thyroid hormones, they seemed normal, and yet they still had hair loss, or the hair was brittle, and it was somehow abnormal. And then I remembered when I came back from my adventure at Yale to Berlin and started my dermatology residency, I was interviewed by the former chairman of the department, who was quite a dinosaur, but a very smart guy. And he said, "What, Paus, you work on hair? I tell you something you don't know about hair." And he had actually figured out that the most sensitive indicator of whether or not you have been perfectly medicated at exactly the right level with thyroid hormone was not the serum level of the hormone, but the elasticity of the hair shaft. And so he went to big length at the Federal Institute of Materials Testing in Berlin, which has been around since imperial times. And they just basically stretch a fiber and they measure its elasticity. And the change in the elasticity, this dinosaur educated me, was the most sensitive indicator whether a thyroid hormone or thyroid disease patient was perfectly substituted or not. I forgot about that, and many years later we said, now finally let's test what do thyroid hormones do if you dump them directly on a hair follicle. At that time it wasn't even known whether there was any direct effect of thyroid hormones on the follicle, because if you have a problem with your thyroid hormones, they regulate so many different genes that it could have been a completely indirect effect, that they changed some other hormones or metabolic factors, which then indirectly impacted on hair growth. But in this model, we could for the first time show that the thyroid hormones directly bind to thyroid hormone receptors, and they directly talk to the hair follicle. And they change much more than we had expected. Not only did they prolong the growth phase, the anagen phase of hair follicles in organ culture, but they also stimulated the production of certain hair shaft keratins. And that, in retrospect, could explain this elasticity change. Because if you change the composition of hair keratins, that also impacts on the elasticity of your hair shaft fibers. So it taught us that. It also showed us that the pigmentation of the follicle got stimulated. That had indeed been reported by some old endocrinologists when they had started giving L-thyroxine to patients. Some of them had reported that they had some repigmentation of graying hair. I thought that was pretty cool. And we also showed that a couple of growth factors that are important for hair growth are upregulated, and those that inhibit hair growth get downregulated. So it all ticked the right boxes, and we left it there. From there to, and in this organ culture setup, you always dump your test compound into the culture medium, which and the follicle then floats around in this medium. That imitates a systemic application, right? Like an oral drug or an IV injected drug. But what nobody has done so far is to topically apply the hormone. And that is what I tried to convince you guys of, and apparently that worked. And we said, well, we have this beautiful skin organ culture, scalp skin organ culture model, where we can take a chunk of your scalp skin. And if any one of you wants to donate some, please do so, because we're always short of it, no? In the lab. And then you administer the test compound, in this case thyroid hormones, in a fairly viscous vehicle so that it doesn't seep over the sides of the punch of tissue. And you see, does the follicle even see what you deliver there? Does it respond to it? And that's the experiments we have been running over the last couple of weeks. First, we needed to work for a few months on finding the right vehicle. And I hope that in another 2 months or so, we will have the first data. Does the follicle even care? If I topically administer in this vehicle, we found thyroid hormone, and there are these two, right? Triiodothyronine, T3, or thyroxine, T4. And that was the other thing we had found in this old study, 2008. In the book, if you open an endocrinology textbook, they tell you T4 itself doesn't work. It first has to be enzymatically transformed in the cell that has taken it up into T3, which is then the active hormone, and that binds to the thyroid hormone receptor, and that then moves into the nucleus, and there binds to primarily genes that have a promoter with a so-called thyroid hormone response element. Yeah, but we noticed, if we looked, for example, at pigmentary responses of the hair follicle, they were stronger when we administered T4 alone than we gave T3 in an about, not in the same dose, but in a bioequivalent dose. And that's surprising. And then when we looked into because that shouldn't happen, right? T3 should always be more effective. So then it turned out, when we looked more into the literature, that yes, other thyroid hormone researchers had noticed something similar in cell cultures, that apparently T4 can also have its own conversion independent effects. And if you look more into this, it gets much more complicated and confusing. Thyroid hormones do not only have this classical effect that they, in the cytoplasm of a cell, bind to a thyroid hormone receptor, and then together with it travel into the nucleus. They are fast membrane effects they can exert, and T3 and T4 may differ in those, and lots of different signaling pathways that you don't find in the classical endocrinology textbook are also activated. So we are basically, to be perfectly honest, working with a black box system here. We have our response organ, we dump something on it, and we don't really know which mechanism will be switched on, and we don't really care. What we want, because we're pragmatists, right? What we want is that the follicle gives us the response we want to see. More anagen, that's the most important one, that the follicle stays longer in anagen. Only when it stays longer in anagen can it make a good hair shaft, a good, well-pigmented hair shaft. And in addition, if it's already miniaturized, or if it's in the process of becoming miniaturized, it needs to be in anagen in order to become larger. Again, that a vellus follicle can become a terminal hair follicle again. So anagen prolongation is the non plus ultra. It's the most important prerequisite for inducing hair growth. Guys, I lost you here somehow. Are you seeing seeing and hearing me?
Can you hear us?
Yeah.
Yeah. So just to give a quick overview of just like for the audience, I guess, of just the study that we're running with Ralf, right? We're testing T3, T4 thyroid hormones on human scalp skin organ cultures. Technological difficulties. But I'll just keep it going. So we're testing T3, T4 thyroid hormone in human scalp skin organ cultures. And we're testing, I believe, at 2 separate dosages. Like Ralf said, we're effectively dumping the thyroid hormones on the scalp skin, seeing if it generates hair growth. If the results are positive, we're going to we'll vote to run sort of like follow-up studies testing combination therapy of the T3 and T4 combined together.
Yeah.
And yeah, I mean, I'll say this. I was wanting to ask Ralf. He has a million ideas why he chose the thyroid hormone study first. But I will say that this study passed overwhelmingly in our Discord. I think the vote was 94-2. So 94 in favor, 2 against. Yeah. Why don't we wait for Ralf to hop back on? And in the meantime, how about we skip to a little bit more of the DAO system versus the traditional system of research, and as well as the IP-NFT Mint that we actually just carried out with Benji like 30 minutes ago to actually mint the JDA that we signed with Ralf, the ownership agreement, onto the Ethereum blockchain.
I just have a question for Ralf real quick.
Oh, here we go. Okay.
Are you hearing me? Somehow you disappeared. I probably disappeared too.
No,
you didn't disappear for us, but so Ralf, just I was giving just a high level overview for everybody of the study. So organ cultures, T3, T4, scalp skin organ cultures, T3, T4, where you were testing 2 dosages of each of the thyroid hormones, or just 1 dosage of each?
Yeah, we I think we begin with 1 dose of each, and then we test them both together and combined. The problem, our biggest problem, is the availability of scalp skin. So when I started in human hair research, the facelift surgery techniques still were quite brutal. You were basically cranking up a lot of your facial skin and then cutting out a big strip. To my great distress, these surgical techniques have become much more refined. Therefore, there is a lot less scalp skin available for me to do experimentation on. So I really am struggling now to find enough scalp skin. And I've gone to the to a great to great or undergone great efforts. Now we are opening a laboratory in Sao Paulo in Brazil, because that's the mecca of plastic surgery, and hopefully we'll get more access to scalp skin. And if there's anyone, if the HairDAO crowd here that considers having a facelift, you better make sure that no scalp skin ever gets discarded and ends up in my lab.
Yeah,
So
well,
I was about to say, Ralph, that's actually one of the biggest thing that's blown me away. Is one of the actual biggest barriers to hair loss research getting done is literally the available of scalp
Yes.
skin.
Yes.
And through various like transplant doctor partnerships and also through our community, that's a big thing that HairDAO is looking to contribute to the space in terms of decreasing friction in as many points as possible. And I think one of those areas that we're very much going to look towards and is actually sort of facilitating the scalp skin for valuable research.
And
I wanted to ask.
Let me make one important comment on this, because this really, really matters. It's the eye of the needle. Access to human scalp skin and human hair follicles determines the pace of progress in human hair research. And if you can change the modus operandi by increasing the access, progress will exponentially follow. So this is so critical that I can't emphasize this enough. So thanks for pointing this out.
No, definitely, and that's actually on the roadmap for us. So just before we keep going, I wanted to say, so I said when you were off the screen for a little bit, this vote passed like resoundingly in our community, 94 in favor, 2 against. I won't tell you who the 2 against were, but no one on this podcast. But anyway, I guess the question is, you have a million ideas. You've been in this space for so long. Why was the thyroid hormone the first study you proposed for the HairDAO community?
Simple answer: low-hanging fruit.
Yeah.
So first of all, whenever you use a drug for treating a supposedly cosmetic problem, right, which we know is not a cosmetic problem if you psychologically suffer from it, then you are really challenged with a huge amount of regulatory hurdles that you have to overcome at very high prices, at very high cost. So using a drug that has already been introduced to the markets for decades, where the toxicology is perfectly defined, there's hardly any agent in all of human medicine about whose side effects we know more than about L-thyroxine, right? That's already easy. Then on top of that, it's a compound that we already know from prior research is perfectly topically applicable. So most drugs that you want to administer to human scalp skin topically, so externally, struggle with making it down into the follicle. We don't expect this to be a key problem here. We still have to prove it because we haven't done it before, right? But the likelihood that we will get the sucker down there is high. And it's probably higher than with most other molecules we could have tested. And the other thing, it's pragmatism. This stuff is dirt cheap. No big pharma industry interest in L-thyroxine or T3. They can't make a big buck out of it anyway, unless they would develop a topical formulation that they could then patent, which is, of course, the hope we will be able to do together one day, right? How far we get there will to be seen, but that's a ship that will only sail once we have seen that we get any effects with the vehicle that we have already chosen, right? Once we are there, then we think about, how can we patent protect the vehicle? But so it's low-hanging fruit is the major the most honest response, but there's another one. So I'm biologically really, really fascinated by what thyroid hormones do to skin, and particularly to human skin. So we have known from for ages, ever since dermatology as a field came into existence and people began to recognize thyroid diseases, physicians have known how strong the skin and the hair follicle respond to too little or too much thyroid hormones. And yet it hasn't been carefully studied. We dump glucocorticoids, so steroid hormones, vitamin D, retinoids, all steroid hormones. We dump them on a daily basis on human skin. We treat plenty of skin diseases with this. And all of these hormones have been big breakthroughs in dermatology. They have changed the face of dermatology. And what is the one hormone we never use in dermatology? Thyroid hormones. What a shame. No? I think 3 years ago, I wrote an essay, I published an essay where I said L-thyroxine is the Cinderella waiting to dance on the floor of dermatotherapy, right? And that's exactly what I think it is. But in contrast to Cinderella, this hormone is also a really, really potent agent. One should not chronically administer. It turned out this is fairly recent studies that people that have been taking for many years or even decades L-thyroxine as a substitution therapy seem to have a higher rate of some types of cancer. Mm-hmm. This is no surprise because thyroid hormone, among the many things it does, it's like a metabolic turbo machine. It really enhances energy metabolism and many metabolic processes, enhances proliferation, so that if you are unlucky enough to have a higher propensity to develop cancer anyway, and then you chronically administer this hormone systemically, this in the long run could be a problem. This is why I think we need to administer it topically, and we need to administer it pulsatile. So let's say for a week or 2 or 3, and then we need to give the skin a rest for a while. And then we administer it again in the hope that this circumvents any potentially concerning side effects.
Mm-hmm. So yeah, just to follow up on that, and I think this is the question that like a lot of the community members will care about a lot, or 2 questions. The first is, if you had to sort of guess right now, put a date on it, when would you say we'll have the initial results from this study to report back? And then second, if this went well, what would be the time frame to actually get a new product onto the market?
Yeah, I think we will have in the summer already. We will know whether we get in our scalp skin organ culture model, whether we get a decent biologically and clinically meaningful hair follicle response. Mm-hmm. That's what we will know with the topical application mode and the vehicles we have selected, which is already a big one, right? Because nobody has ever shown this, that topically applied thyroid hormones does anything to a human follicle. So if we can show that and hopefully tick the right boxes and say, oh, anagen is prolonged, maybe a little positive effect on hair shaft formation, maybe the right growth factors up regulated and the right ones down regulated that are hair growth inhibitory, then we know we're on the right track, and that will be the summer. From there, to be able to then run a clinical trial, which is of course the one thing that matters. Double-blind, placebo-controlled, prospective, randomized clinical trial. That depends on what the regulatory agencies will demand in terms of additional safety data and toxicology data. Because yes, thyroid hormones have been topically applied to mice, where they stimulate hair growth, where they stimulate wound healing, but they have not been topically applied to humans. So regulatory agencies will want to know if you, for weeks on end, administer this potent thyroid hormones to the scalp, how much ends up in your blood? Mm-hmm. And could this give you hyperthyroidism? Could this give you thyroid hyperfunction, right? And how will the thyroid gland respond to this? And what one usually does to test this is not only look at the blood level of the administered thyroid hormone, but you also look at the neuroendocrine system that regulates thyroid hormones. So you may remember that the thyroid hormone is made in the thyroid gland normally. And thyroid hormone is so potent that in contrast to most other hormones, which can be made by all sorts of cells and tissues, thyroid hormones apparently can only be made in the thyroid gland. And it's like in a little nuclear power plant contained in there, because this shit is potent. And so biology wants to keep it contained in a unit where its release is highly controlled by the brain and the pituitary gland. And so the hypothalamus produces a hormone called TRH that then tells the pituitary gland, make thyrotropin, TSH, which then tells the thyroid gland, okay, give us a bit more of this powerful stuff. And then if more gets released, that talks back to the brain and says, stop giving us TRH signals, and that then reduces the production of thyrotropin by the pituitary gland, and then the thyroid gland downregulates its production again. So we need to also check, and I'm sure that regulatory agencies will demand that we check in the blood after topical application, how has that impacted on these neuroendocrine controls. You can measure the blood level of thyrotropin very easily. It's being done routinely in internal medicine clinics around the world on a daily basis. So, and that depends the time until you will then be permitted to run a formal clinical trial. Mm-hmm. The thing we have going there for us that should accelerate this and shorten this time span, which can be terribly long for most new drugs, is that we can always argue, well, look, we are giving the hormone already systemically to patients in high doses for decades. No? So how damaging can it possibly be if a fraction of this makes it into the blood after scalp application? And then we'll see how the regulatory agencies respond to this, right?
Definitely.
So I would hope this goes fairly fast, let's say within a year, which would be really fast. In the pharmacology world, this is fast. And we're talking pharmacology here. This is not cosmetic what we are doing, right? We are taking a very powerful hormone here and we dump it on your scalp and hope only good things happen. Mm-hmm. That's the other thing. Why we do all this testing in our scalp skin organ culture. We also look out for potential adverse effects so that we anticipate before we put this on a living human scalp. We already want to get indications. Well, are we calling in false friends here with this hormone application? Are we tickling the wrong signaling systems that we better don't touch? So that information we will also have.
Yeah. Gotcha. And so this, I got another question for you, and this one's actually from a Discord community member. Shout out Banana Fun. But he wants to know sort of like what the theoretical side effect profile could look like, also the efficacy compared to minoxidil. Obviously, efficacy could be more of an unknown, but would we expect sort of like hyperthyroidism?
Yeah. Okay, so basically, if you want to make it short, if you want to know the potential mechanism, the potential adverse effects, you just have to get yourself a box of L-thyroxine and look at the long leaflet there of all the side effects that have been described there. The likelihood that you will get any of this, I would say, is below 5%, because the dose that will arrive in the system will be so much lower than if you take a tablet of L-thyroxine, right? The other big question that we don't know, and we hopefully will also learn this within this year, if you administer topically to the skin L-thyroxine, it first has to be metabolized it will be metabolized in skin into T3. How much of this even then makes it into the system? How much gets trapped in the skin? And ideally in the hair follicles, which have expressed a lot of receptors for it, so they sort of suck it up. So that's one thing. Then if you directly administer T3, that will immediately bind to the receptors. That should get even more trapped in the skin than L-thyroxine. All that is important to keep in mind if you try to anticipate the potential adverse effects. So the lower the percentage that a compound that is topically applied actually makes it into the system, the lower the likelihood that you will see any of these adverse effects.
Mhm.
Yeah.
But they cannot be excluded until proven otherwise.
Yeah.
It
Well,
would be, I mean, in the end, I'm a physician, so it would be completely irresponsible if we were talking down the potential risks only because I'm so excited about this stuff. No, that would be irresponsible. I'm not talking it down.
Well, what's interesting is you're actually playing it safer than even industry today. Like there are people who do tastride mesotherapy has become a pretty popular treatment, and I've looked into it, and you'll have some people saying that it doesn't go systemic, it only just sits on your scalp perfectly. Then other people saying, oh, it's just as if you took the pill, you might as well just take dutasteride and save yourself
I agree.
$1,000. Yeah.
So I mean,
Yeah.
people are doing so many. I mean, let's be honest about this. So there are so many hair nerds out there, no? A present company excluded, that have absolutely no inhibitions of doing all sorts of things to their hair, even though it's nonsense science, based on nonsense science, or just based on what some influencer who often doesn't even know what the hell they are talking about. Is recommending, or what some marketing department has whipped up. I mean, I'm totally amazed at how entirely irrational people are if it comes to hair, and how much they how much they are, or how little they are uninhibited from making themselves into a guinea pig. This is, to me, mind-boggling. Gives me almost hair loss.
People want their hair, Ralph. People want their hair.
They do, but can we please take a little bit more rational approach here? And we have the right model to test whether something does work or not. If it does work, well, then in our models, then I dump it on myself, and only if these models have not raised any red flags, right? What might happen? So be a bit more responsible. You have only one body. You have 2 million hair follicles, one body. Be a bit more careful with it.
Yeah. So Ralf, we have one more community question, then we'll go into your experience, like how this experience has been sort of getting funding from HairDAO, and then we'll sort of close it off with the IP-NFT Mint. But I guess the last community question that we're getting, and I'm not sure who this is from, but I'm gonna go out on a limb and say Jumpman, because this is
his name is David New.
Okay. Oh, okay. There we go. David Davy Boy. So why are macaws not used more frequently as a hair loss model? How good are they as a model?
Macaws.
Macaques.
Macaques. Yeah, I was getting.
Never said it out loud.
So you're talking about the stump-tailed macaque. Yeah, that's actually a wonderful model. It's a beautiful model. So the stump-tailed macaque, as you probably have read, is the only animal model that gets male pattern balding, right? And that has been around for a very long time, since the 1970s or 1980s, and it was pioneered by the Oregon Primate Research Center. Problem is that non-human primate research has really fallen out of favor. There are some drugs where it's mandatory to test them on non-human primates. For example, all sorts of drugs that target the brain have to be tested on them. But for a supposedly cosmetic problem, to test this on non-human primates, you can imagine the outcry of the animal rights community that this will cause. Even though I have to say, I'm of course guilty of having done lots of animal experience myself in a former life. We are now facing a situation where there is so much clamor to not use any animal models for whatever new drug you develop, and rather use humans right away as guinea pigs. Try to go from cell culture and maybe some 3D constructs of cells straight to the human being. No, I find that as a physician entirely irresponsible. you can never reproduce in cell culture, not even in 3D models, the complexity of the human organism. And using primate models and mouse models is a necessary step to avoid that we're dumping this immediately on humans until we have very carefully seen what could happen, for example, in primates. So to the question, why is it not being used anymore, this wonderful primate model? It's a shame it's not being used as much as it should have, because that model has taught us more about how a follicle gets miniaturized and how it can be reversed, this miniaturization, than any other model has so far. Now I hope our new human skin xenotransplant mouse model will replace the primate model. But I can only say that was a wonderful model. And not to use it scientifically is a crime.
Yeah.
Okay, awesome. So I'm seeing a bunch more community questions now, but we'll save those for following podcasts, because we will do this again with Ralf. But I think now that the good part, and this is the part maybe where you can grill us a little bit, is to now pivot to what your experience has been like. You've received funding a good amount from the traditional sort of system, if you will, and now this is your first time receiving funding from HairDAO. I think it'd be interesting because at the end of the day, our at the HairDAO's end goal is to effectively make it as easy as possible for a traditional researcher like yourself, an online native researcher like so many of the people we have in our Discord, or all the other traditional researchers in the world, to submit ideas to the community, and ideally for just the best ideas to win out, sort of credentials aside, the best ideas win out. We fund those and actually execute those studies. Obviously, you were our first sort of guinea pig in this regard, and so there was some friction that I think there was friction where we've worked. For the next time, it'll be better. But it'd be interesting to sort of hear your take on it, and then we'll give sort of, I guess, a response and sort of the ways we're thinking about like further facilitating
all right.
more research done more frictionlessly.
So my initial response when you guys contacted me was a little bit like Benji's response. I didn't understand a word you were talking about. And this comes from a guy who has already trouble using his cell phone, right? I'm not really in any of these internet fora, and if I manage to open my email and send even a response, I consider myself fortunate. So you operate in a space out there in cyberspace that is very alien to me. When I read a paper, I read it usually in a printout. Imagine that. The world you operated was alien to me, but I realized, of course, the potential that it has, and that the business model, that the people that actually want, that have a vested interest in seeing research progress, should also not only have a vote in where the funding is going, but should also somehow contribute to finding the money that then propels the research. That model makes perfect sense, and I've had prior experience with this kind of approach in another hair disease called alopecia areata, this most common autoimmune hair loss disorder. And the National Alopecia Areata Foundation in the US, based in California, has been doing over the last couple of decades pioneering work in collecting money from donors, from families with affected patients, which then brought the best scientists in the field together and first of all told them, well, guys, we really are hurting here, do something. And then had the scientists talk to each other to figure out what are the research priorities. And you should have seen the early discussions, everyone disagreeing with everyone else on what the priorities were. I was saying one thing, somebody else said, "Oh, that's all nonsense, Ralf. We should be doing it completely different." I say you bark up the wrong tree, and this is how it went. And now all of this is happening not in a room. It's happening on the internet and in real time often. So this is exciting. I mean, of course, the more different nerds you have talking to each other, the more difficult it gets to get a constructive discussion going, right? And sooner or later, the ball has to drop and you have to take decisions. So what really is the priority here? And sooner or later, one also needs to listen to some experts, right? Hopefully not always to the same ones. But in general, I thought the approach you have taken is not only creative, it's also necessary, it's democratic. Science should never be confused with democracy. Science has also nothing to do with beliefs, right? We're not in church, shul, mosque, anything here. Science deals with concepts that are more or less persuasive based on the currently available data and on logical arguments that you can make to interpret these data. And then only time will tell whether the concepts were true, and whether the working models you operate with today hold true. Only time will tell. But there's nothing that has to do with beliefs. And that's what I liked about you guys too. You were very rational. Not only, even though you most of you don't have a biology background, right? You really knew the literature better than many dermatologists, and even better than some hair researchers. So that was almost scary. You were, out of a sudden, you had to be so goddamn careful of what you said, not because you were in real time checking already on the internet. Is that really true what he's telling us? No? My God, I'm not used to that. But it's good. It's healthy. It actually fertilizes constructive debate if you keep it under control, right?
Absolutely.
I like it. I love it.
Awesome. And so that was a really kind answer. I will give a funny little anecdote about sort of how early we are in the decentralized science space. And that is when we actually wanted to fund Ralf, we keep all of the HairDAO's assets on chain. And so the process of funding Ralf, we actually had to go through, we had to send the money to his son's Coinbase account, who could then forward the funds to the CUTANEON bank account. And so I think it's just
at least the guy knew what a coin account is, no?
Right, exactly. And so
I had no goddamn idea. Yeah.
So there's a ways to go with the tools. We have great partners, Rain now, who are helping us out with that, and hopefully we'll continue to make that process more seamless in the future. We're still early, but I think that's sort of where the opportunity is. So with that, I think we'll transition really quickly to our last topic of the day, which was the IP-NFT Mint, which I think Benji should explain since he's actually one of the product managers who led the formation of the IP-NFT Mint product, and talk about it a bit, Benji. And I think it's pretty awesome what we just did with this thyroid hormone study.
Awesome. So yeah, we'll include the link to what is now HairDAO's intellectual property rights to the research that Ralf is coming up with, that is on chain and now is property of HairDAO, which is super exciting. And you can find it in the multisig for all to see. But yeah, the basic premise here is that, crypto, if there's one good application of it, it's for raising funds. And so, because there's this kind of gap in funding that exists from traditional funding organizations, by building this kind of group of hair loss researchers that want to contribute ideas, that want to contribute capital, allowing them to basically fund research in areas that are interesting to them and that impact their own lives. And so, we think this really creates a better supply and demand for research than currently exists. And so the IP-NFT is basically the vehicle that these DAOs, these decentralized autonomous organizations, can use to not only fund the research, but be able to get some of the rights to the intellectual property that come out of it to sustain the research. So that it's not just purely like a grant with no strings attached, but also there's these rights that come back to the DAO so that, they can basically create something analogous to a university endowment that basically just grows and grows and grows, and continues to deploy back into hair loss research to continue the amazing work that's being done, like researchers such as Ralf. And yeah, I think what's been the most impressive to me and honestly terrifying is the quality of the discourse that's going on in Discord right now, in HairDAO's channels. I mean, to see so many people talking about, different transcription factors and, growth factors and the multiple feedback loops. Yeah. And it seems like every single day there's a new person to admire for their depth of knowledge. And it to me, it just shows that paying that individuals go through looking for answers. And what it really leads to is high quality questions, which Ralf has the resources to hopefully answer, or at least get somewhere closer to the truth. So we're really excited about what Ralf is working on, and honestly, we're excited to crowdsource some new great ideas to continue. Just trying to find more and more solutions. If thyroid hormones only work in people with hypothyroidism, well, what does everyone else do? So, basically giving a treatment for everyone is the goal.
Of course. Can I add a few things, Andrew, to this? Also extending upon my answer to your previous question. So the current the problem with the first funded project, HairDAO funded is of course the low budgets. We knew we just had to get started somehow. So these budgets are fairly low. They are far below what you normally need for this kind of project. But I think it was important to just get started. And then if the data are exciting enough, I'm sure there will be additional interest in following this up and going deeper. The other thing that I perhaps should emphasize even more is I said initially that all real progress in hair loss treatment will be based on understanding the biology properly. And the only funding mechanism we have so far is the National Institutes of Health, which fund most of that research. But if you look at this, and I've only recently began to submit grant proposals to the NIH, you realize if you're not submitting a grant proposal that has some mouse mutant in there, you are almost as sure as dead with your proposal. So the National Institutes of Health, to some extent, have degenerated into the National Institutes of Mouse Biology. And that's exactly where all the money goes, mouse biology. And if you do enough mouse work, often you don't even have to justify that this is whether or not this is clinically relevant. This is how the current publicly funded research, particularly in the skin arena, but I'm sure also many other areas, is going. And that is terrible, because that keeps many university researchers who would want to generate clinically relevant data in the human system. It prevents them from doing that because they just don't have any way of funding it unless they have good industry contacts, right? Yeah. Which very few do. Yeah. So you fill an absolutely vital niche that the National Institutes of Health still has not understood it should be covering. And that not only goes for androgenetic alopecia, it goes for alopecia areata, it goes for serious hair diseases, where it's mouse work, and mouse work again that gets funded. That is a very misguided strategy, and you do something against it.
Yeah, and a great analogy, or really truth that we like to talk about, is that there is no hair representation at the NIH. When you apply,
absolutely,
National Institute of Skin and Musculoskeletal and Arthritis Disease is where you have to go to get your funding.
Yeah. And then of course, you can imagine how that goes if a grant proposal talking about male pattern balding is being reviewed by a rheumatologist, right? You can imagine how excited that rheumatologist gets, unless he has very serious hair loss himself and wants something to happen fast. So, and that's the other point. I'd still like to make. Since the key to making breakthrough treatments is really understanding human hair biology better, this unfortunately takes time, and you need a long breath. All of you in a hurry, right? You want to treat hair loss, you want to cure hair loss, ideally by yesterday. It's not gonna happen, right? You gotta take it one step at a time, and one step at a time is you need to define, so what is the key problem in male pattern balding? Miniaturization of the organ, anagen too short. Those are the two key problems, and those we need to tackle in the right models. That will take time. And if you don't invest into basic research into this, you will not see the fast progress you want. So now we are running a low-hanging fruit project just to keep the crowd engaged and hopefully generate data fast. But what we really need to be doing is to go side by side with low-hanging fruit projects and serious long-term basic hair biology projects. It must be done in the human system, and I really hope that you can stimulate enough excitement in your community and commitment that this is being executed.
Absolutely. And so to close it out here, if we'd love anybody who's watching to come join our community, whether you want to do work, research to help us out in any way. It doesn't have to be scientific research. It could be marketing help. It could be operations help, whatever. We need all that. And then on a shameless plug, we're doing the hair token auction on February 23rd. The funds raised with that auction will be used to fund more hair loss research. And then just sort of the mechanism of the way this all works, right, is that the hair token holders on a 1 token per vote basis get to govern the IP-NFTs that we mint from the research that we're doing with professors like Professor Ralf Paus. Not investment advice, but February 23rd. Yeah, thanks so much for joining us, Ralf. It's honestly been so awesome working with you. You've been like laying the groundwork in this field, honestly, thanklessly for the last what's it been, 40 years, half a century, and so so we really appreciate it, and you have like a huge fan base in our Discord group, and so I know everyone's super excited to hear from you, and looking forward to doing more episodes.
Great, me too. Take care, guys.
All right.
And have fun.
Thanks so much.
Keep up the faith. No, no beliefs, but serious funding for solid biology.
Yes.
Yeah,
All right.
exactly.
Take care, guys. Bye.
Bye-bye.
Take care.